Well, just days after news broke of a big spike in premiums, today began open enrollment for the controversial Affordable Care Act, also known as Obamacare. And while it's helped tens of thousands of people on both sides of the state line get health insurance, records show it is now less affordable and offers fewer options.
41 Action News investigator Andy Alcock dug deeper to find out if Obamacare is now in trouble.
Today is the first day of open enrollment in both Missouri and Kansas, including sign-up assistance here at the Rogers Health Center in Kansas City. Months ago, the nation's largest health insurer, United Healthcare, dropped out of the ADA due to nearly $1 billion in losses in the last 2 years. Aetna then followed. Those decisions are having a major impact in our area.
When Mark Goodman retired from his job, he was able to get Cobra health insurance, where you pay all the cost of your former employer's coverage. But when that plan ran out, Goodman realized the Affordable Care Act was his only option.
I found out that the Affordable Care Act was so much more expensive, a lot more expensive than what I had previously been on.
Here's how the costs compared in his case. Cobra's monthly premium was $1,566. ACA was $1,247, but only covered 3 of his 4 family members. The network deductible was $2,600 on Cobra versus $12,000 with the ACA.
Cobra used to be an expensive form of insurance, which everyone told me for years, not something you want to do.
Well, there's no easy answer to this.
Joseph Jefferson works for the Good Samaritan Project. That organization helps people with HIV. He says the ACA has helped his clients and other people with chronic health issues get quality health care. But he also says the ACA is far from perfect.
There's a number of places we can look to I think, do some course correction with Obamacare, but Congress is going to have to step in and make some tweaks.
One problem is insurance carriers are dropping out of the exchanges. Both United Healthcare and Aetna have left the ACA market in Missouri. It leaves 4 insurance carriers for the state for 2017 coverage, with only 1 carrier available in most counties. There are 2 for the Kansas City area, Blue Cross and Blue Shield of Kansas City and Humana. According to healthinsurance.org, Blue Cross is proposing a 29% rate increase, Humana just under 35%.
I think that anyone who fairly looked at this law when it was passed would realize that that would happen.
Clark Schultz of the Kansas Insurance Department says that state is also seeing similar issues. Blue Cross and Blue Shield was going to be the only option in Kansas, but the insurance commissioner recruited a new provider, Medica, out of Minnesota. Blue Cross for the Kansas side of the metro is proposing a more than 28% rate increase and more than 47% increase for the rest of the state. Schultz says despite increasing penalties for people who don't sign up, young and healthy people aren't buying. It means the ACA is covering mostly the elderly and sick people with pre-existing conditions.
It's a little bit like somebody wrecking their car on a Monday and then buying insurance to cover their wreck on Tuesday.
I certainly am not one who is interested in, wanting to rip apart Obamacare because we have a risk pool problem. We definitely have a risk pool problem.
The federal government is paying for part of the cost for more than 80% of ACA members in both Kansas and Missouri. Enrollment is up in both states, but Schultz fears if costs keep rising and the number of providers keeps dropping, the ACA could collapse.
I think that it could.
Are you concerned that might happen?
I'm very concerned about that.
I'm a sickness away, or my wife, sicknesses or illnesses away, from going to the poorhouse, I guess, because the cost of this insurance is so great.
Goodman took his concerns to Missouri Senator Claire McCaskill's office. After months of getting the runaround, a rep told him there was nothing they can do. Since that time, Goodman's wife has taken a new job, so now the entire family is on that company's insurance plan. I'm investigator Andy Alcock, 41 Action News.